Good day, I'm Stephen McHugh, and this is your JIS News for Friday, August 28. Government is moving quickly to increase the cadre of public health workers in the system to help manage the country's response to the COVID-19 pandemic. These include the recruitment of 120 medical officers, for which the Ministry of Finance had previously given approval. Health and Wellness Minister Dr. Christopher Tufton says deployment of these officers could begin within a week.
You would have recalled a discussion around those medical officers who did not have posts in the public health system. We have gotten the go-ahead to engage these persons, and I am told now that we will have contracts effective the 1st of September to engage these 121 medical officers.
The number of community health aides will also be increased from 750 to 1,000. And the regional health authorities are now assessing the number of additional public health inspectors to be engaged.
And the public health inspectors are very important to the process. They are at the local parish level. They go out in the field. They assess what is happening. And one of the primary reasons for engaging them is to provide leadership in terms of, the community health aides to assist with that.
In the meantime, the University Hospital of the West Indies is taking steps to increase its capacity to admit and care for COVID-19 patients. The UHWI, along with Princess Margaret, is one of two hospitals reported to have exhausted their COVID beds earlier this week. During the Health Ministry's digital press briefing Thursday night, CEO of the UHWI, Kevin Allen, said a mix of measures were being employed to make more beds available while addressing staffing concerns.
The situation as it is now will require us to expand. It may require expansion of our intensive care unit capacity, and it may require expansion of our ward capacity. At the present time, even though the ward is at capacity, what we plan to do is to move elective or non-COVID patients out to expand our COVID wards. As the number of cases increase, we know that we have to reinforce these teams, and we have that plan that's there to reinforce the team. And we, in some instances, will have to ask the other specialties to help with their patients.
Chief Medical Officer Dr. Jacqueline Bisesa-McKenzie pointed out that, given the rapidly increasing COVID-19 cases in the country, more hospitals could soon find themselves in the same position as the UHWI and Princess Margaret. As a result, she says the ministry's focus now has to be on how to shore up capacity right across the public health system.
The minister, the permanent secretary, and myself as the executive management and the rest of the team at the ministry are now looking at this new phase in terms of even more preparation, in terms of particularly focusing on our healthcare providers and how it is that we address some of these issues.
As at August 27, Jamaica has recorded a total of 1,870 positive COVID-19 cases. The bulk of the newest cases were registered in Kingston and St. Andrew, Clarendon and St. Catherine. There are currently 933 active cases being monitored, while 846 persons have recovered and been discharged from care. Director of Elections Glasspool Brown is assuring the public that the Electoral Commission of Jamaica, ECJ, is taking all necessary steps to protect voters and ensure a free and fair election come September 3. Mr. Brown was speaking during the Ministry of Health's digital press briefing Thursday. He reiterated that the ECJ was at an advanced stage of readiness with a mix of measures to ensure the safety of both electors and the electoral staff.
We have sought to recruit in excess of 7,400 persons, and we have put them into our team known as a sanitization team. Those 7,400 persons will spread across the 2,200 polling station location on election day. That team is geared towards ensuring that every person who enters our polling station location has on a mask. And also, that team will ensure that everybody who enters through that gate is sanitized and their temperature is taken.
The Director of Elections revealed that in addition to consultation with the Ministry of Health and in adherence to WHO COVID-19 protocols, the ECJ examined what was done in other countries which have hosted elections during the pandemic. He said the ECJ's resulting COVID-19 election protocol would operate on the presumption that every elector is positive, therefore driving measures designed to minimize the possibility of spread. In excess of 20,000 persons will be working with the ECJ to execute the August 31 Special Services election for Election Day workers, police and military personnel, and the September 3 general election. Health and Wellness Minister Dr. Christopher Tufton announced Thursday night that the National Health Fund would be providing all 139 duly nominated candidates with a small quantity of masks and sanitizer for distribution. He said this was to support public health mitigation measures. In other news, work is expected to resume on the $5.7 billion Western Children and Adolescents Hospital in St. James in short order. That's according to Director of the Western Regional Health Authority, Errol Green. He was speaking with JIS News recently. Due to the outbreak of COVID-19, work has halted on the 220-bed facility, which was being built on the grounds of the Cornwall Regional Hospital. But Mr. Green says efforts are now being made to recommence construction of the Children's Hospital, which is a gift from the People's Republic of China. He says a small team of Chinese engineers and workforce are already here and are awaiting the bulk of the group to come to Jamaica. Meanwhile, some of the materials and equipment needed for the construction are arriving in the island on schedule. Once completed, the hospital will be equipped with the necessary modern technology to treat illnesses and cater to the health needs of persons from birth to 18 years old. The Bank of Jamaica is projecting that near-term rate of inflation for the country will be in the range of 4 to 6%, which is within the BOJ's target. Governor Richard Biles gave the update during the central bank's digital quarterly press briefing on Wednesday. He said a 5 to 6% outturn was projected for the July to September 2020 quarter, 4 to 5% for the October to December 2020 period, and 5 to 6% for the January to March 2021 quarter. Mr. Biles says this near-term forecast is largely being influenced by a deceleration in agriculture and processed food price inflation, along with higher imported inflation, which is a general price increase resulting from heightened costs of imports. Over the next 2 years, the governor says inflation is projected to remain in the 4 to 6% band. And finally, the Cannabis Licensing Authority, CLA, has issued 67 ganja cultivation, retail, processing, research or transportation licenses to local companies and individuals since its establishment in 2015. The disclosure was made by Director of Research, Development and Communications at the CLA, Felisa Bailey, at a JIS think tank on Thursday. She said the licenses granted included 28 for cultivation, 23 for retail, 11 for processing, 4 for research and development, and 1 for transportation. For the 2020-2021 financial year, Ms. Bailey said the CLA had so far issued 7 licenses. There are also 21 applicants at the license-granted stage of the process.
And what this means is that upon the payment of the requisite license fees and security bonds, these licenses will be issued. Due to the impact of COVID-19, however, it is estimated that these payments should be made within the next couple of months.
The CLA's Director of Research, Development and Communications says the authority is working on several key projects to facilitate the growth and development of the industry. These include amendments of the interim regulations and the finalization and promulgation of regulations for the import, export, transit, and transshipment of cannabis. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.